after the operation, the patient will leave in.
So it really depends on the procedure. If it's a short procedure, usually the patient can leave in the same day. If it's an arthroscopy for a meniscus or an ACL, so they stay 1 day, a reconstruction of a ligament, then usually they can stay, for 1 day in the hospital or less, a couple of hours. And then usually they start physiotherapy here. They get like all kinds of treatments for pain and for physiotherapy with our physiotherapist that works with them. And then they can fly home. If it's a longer procedure or a bigger procedure like total joint, if it's total knee or total hip, then usually it depends on the deal, but they have like a specific deal in the Sutta or in Herzliya that they stay, depends on the deal, like between 5 to 7 days. And then after that, during this time they get usually physiotherapy, they get rehab, they get whatever they need during this period, and then they fly home. Or stay another week if they want for rehab.
And afterwards, about half a year or a year, what about checking how it's going?
So usually what happens is the first check-in is after the surgery, of course. I visit them, I see them every day in the hospital, and then when they're discharged, usually before they fly back, I see them always just before they fly back. If you need to take out stitches, if you need to treat the patient, whatever. And then it really depends on the procedure. If the procedure is large, like a total joint, total knee or total hip, then usually I see them after, it really depends on them, but usually after like 6 months or a year, they come back, usually happy, walking.
Can they just send you an MRI disc and you...
Yeah, usually I can at least evaluate what the MRI shows. Usually, I can recommend a procedure, but without examining the patient, I cannot definitely say which procedure they will benefit, because sometimes, there are patients that have like, 2 patients with the same problem in the knee. One of them still does hiking and skiing and running and stuff, another doesn't do anything, sit in a wheelchair. So it's really, pain is very subjective. So usually you have to evaluate their function, you have to evaluate which procedure you can do medically. If they're up to like a large procedure, or if they're very ill, then you only can do like a small procedure to help them, things like that. So usually the starting point is usually some kind of imaging, X-ray. What I usually like is X-ray and an MRI, if they can get. X-ray usually weight bearing, if they can stand, and then do the X-ray when they're standing, because then you can see the deformation, the deformity when they put weight on the leg. So usually X-rays, and then MRI if needed.
X-rays in 2 dimensions?
At least 2 positions, yeah. If you need specific, so usually the knee, we do like 3 positions. It's like AP, lateral, and sky view, which that way we can see the patella. And if it's the hip, usually we have a pelvis and an AP and lateral hip procedure on the area that hurts.
Patients need strong fixation after operation of the knee joint.
So usually the patient don't need anything after.
No fixation.
Unless I do reconstruction of, specific surgeries need sometimes a brace, but usually it's not something. Most of the patient leave without anything, just like stitches and a bandage on it. That's all. Okay. I'm very active and I push forward to them going back to activity very early. So usually I make them walk the same day, or the day after maximum. So usually they walk the same day, even with very large surgeries.
2 hours after.
So 2 hours, if it's a small surgery, they walk 2 hours after, it's no problem. But even if it's a total joint, a hip or a knee, Then usually I visit them in the afternoon and I take them for a small walk
Great.
just to show them that they can.
Great.
Okay.
Копаем.
So usually it really depends. You know, young patients, you know, with arthroscopic surgery usually need crutches, kabine, for a very short time. Older patients usually need a walker, kalichon, and then, but they're very fast, they switch their cane.